A lot of people say to me that they hate that they've been pushed into the role of being a patient. They didn't choose to have cancer, they didn't ask for this, and it can often completely upend someone's life. And one way to help manage that is, oddly, to embrace the idea of the patient role a bit more. So leaning into it a bit and thinking about your job as a patient, thinking about what your job requirements are, what the specifics of your role are, and thinking about on any given work day in your job as a patient, what you need to do to achieve your KPIs, for example. And that can provide a bit of containment to this idea of being a patient. Rather than being a patient all day, every day throughout a week, you can think about it as your job and contain the hours that you're committing to that job a bit, to provide a bit of boundary between your usual self and your patient self, or your usual roles and your patient role. So some of the KPIs I might think of for a patient role would be keeping up with exercise, perhaps coming along to the EMC and getting your prescribed exercise each week, looking after your diet and making sure you hydrate before and after chemotherapy, for example, getting some rest and some sleep, thinking about maintaining contact with friends and family, because that's an important part of being a patient, is keeping connected with the world and the people who love and care about you. It might be nourishing some of your interests. It might be reading books or watching certain TV shows. It would include things like taking the dog for a walk if you have a dog. That could be one of your requirements of your patient role, because it helps keep you active. So there's lots of things you could kind of workshop and brainstorm that you would think someone who is a patient needs to do in order to be successful at their job.